Hello, we are a group of 6 students from Tuvanan High School, and today we will be presenting to you about our project, Lessons for Future Respiratory Pandemics. Our presentation includes 5 main parts, so now let's get into the introduction. As you all know, the world has gone through numerous respiratory diseases, almost all of which left a high number of casualties and an economic crisis. These show how ill-prepared we are when facing a pandemic, thus making it essential to take lessons from the lack of preparation and global cooperation. About our method of conduct, we have employed multiple methods in the course of completing this document, which chronologically is researching on several respiratory pandemics, comparing and summarizing the similarities among the strains of virus and pandemics. From there, we design a procedures plan that is suggested for every country to help prepare and prevent for future respiratory pandemics, and finally drawing a conclusion. About our expected outcomes, the aims that we had in mind at the start of this project were no different from what we do now, which are raising awareness about the current reality and shedding lights on various countries' past responses to respiratory pandemics, both successful and failed ones. Also, providing essential and applicable general procedures to any policy of any government designed to protect the well-being of its citizens from future novel respiratory pandemics.
So now we come to the second part, the comparison one. After researching, we choose 6 respiratory pandemics that are among the most severe, both in terms of fatality and worldwide impact, to analyze and compare, which are Spanish flu, Asian flu, Hong Kong flu, Russian flu, COVID-19, and pneumonic plague. About the symptoms, the typical symptoms include high fever, body ache, tiredness, and other common symptoms of an influenza illnesses. About the death toll, the number of deaths during every single pandemic was counted in millions. Recorded deaths range mostly between 1 and 4 millions, keeping the global population mortality rate under 1%.
Talking about the common features of major outbreaks, the second waves were usually more severe than the first waves due to the influences from the first waves. The third and fourth waves are generally less relentless, maybe due to the experiences gained from the 2 first waves. Secondly, the pandemics typically needed 1 to 3 months to spread around the world, except for the Hong Kong flu, which only accomplished the same feat in just 2 weeks. The pandemics mostly occur in certain seasons, possibly due in main to the appropriate temperature, which helps the virus grow. In terms of responses, it is evident that different responses were employed for the pandemics. For the Spanish flu, COVID-19, pneumonic plague, the adopted responses are quarantine, facial mask, and disinfection. During the Asian flu, Hong Kong flu, the governments put little to no effort in quarantining or taking any measures to push back the disease, as vaccination was considered the only method. However, the vaccine arrived too late and was insufficient. Finally, in terms of Russian flu, there was no standard treatment for the disease.
So let's come to the next part, ultimate solution. So after looking at these diseases and how countries have dealt with them, we have compiled a list of measures that countries can take to deal with potential future pandemics a lot better than they did in the past. Number 1 is surveillance. We cannot realistically hope to prevent new viruses from rising with our current level of knowledge in medicine, our political and economic climate, as proven by the advent of COVID-19. So when it does come, the best way to prevent its global spread is to have healthcare workers be constantly on the lookout to surveil and immediately report any cases that might be indicators that there is a novel respiratory virus. Number 2 is that we have to contain and limit initial spread. Please place ARI patients in an area separate from other patients and evaluate their conditions, their symptoms as soon and as regularly as possible. encourage them to use respiratory hygiene, like covering their mouths and noses while coughing or sneezing, to reduce the disposal of droplets that might contain the infectious particles. Number 3 is the containment at international borders. When a novel respiratory virus is confirmed, countries should have exit screening instead of entry screening. It just works better because it may reduce the number of affected passengers on board and therefore decrease transmission. Recent research has even indicated that the complete closure of air travel may not be necessary, and that sometimes the closure of high transmission risk routes may make a lot more financial sense and be a lot less disruptive. Number 4 is early diagnosis. The ability to deliver rapid testing is essential because only with an early diagnosis can we enforce good control measures and keep the disease at bay while further research and eventually the development of a vaccine is underway.
Another lesson from H1N1 in 2009 is that our plans for defense against the pandemics need to be flexible, and the public health response needs to be able to adapt quickly to nuances of individual pathogens. These types of communication breakdowns between clinicians and public health officials are another area that needs reforming, so that the whole process of responding to epidemics is substantially more amenable. Isolation also plays an important role in our ultimate solutions. In a hospital setting, it is critical to treat all patients with respiratory tract infections as contagious and have appropriate protective measures in place to protect the staff and other patients. Basic measures such as limiting or preventing visitors, keeping the number of hospital staff having contact with infected patients to a minimum, and strict infection control, basic measures, hand washing, and proper fitting masks are crucial. All public health pandemic plans advise that all possible infected individuals should be kept in isolation. Public establishments such as schools, cinemas, and restaurants need to close down, or at the very least, mitigating their customer to a half. It is essential to employ the use of personal protection measures, such as appropriate equipment as determined by a risk assessment of pathogens like gloves, long-sleeve gowns, eye protection, and facial mask when having close encounters with the patients. There should consequently be means to monitor medical workers' compliance with proper use of PPE. As for antivirals, they were clearly effective during the spread of H1N1. However, the current drugs might not work so well on the novel pathogens. Now we came to the final solution, which is also a question that begs our attention: the development and distribution of vaccine. With the current technological and scientific advances in the world's leading economies, it is not how swiftly vaccines are created that is a problem, but rather their equal distribution among developed and developing countries. Steps have been taken in the right directions, one of which is a worldwide initiative called COVAX, but the result has yet to prove satisfactory.
Now I will be talking about our conclusions. The increase in the rate of emergent respiratory viral infections in the last 15 years is driven by the convergence of global factors, including growth in the human population, urbanization, changes in the interactions between human and animal populations, climate change, and increases in international travel and trade. It seems unlikely that we can prevent the new pathogens from arising, so enhance syndromic surveillance to provide rapid and early identification to prevent spread is crucial. Experience from previous pandemics has taught us that healthcare institutions are major foci of disease transmission. All institutions need to have the facility to isolate infected patients and have maximal protection for staff. There is no doubt that personal protective measures such as hand washing and avoidance behaviors are effective. And the general public also needs to act responsibly by staying at home if unwell and not traveling when potentially infectious. Mechanism for international communications around clinical features such as infectivity, disease course, and treatment responsiveness are becoming more robust, with trust improving between countries.
Special thanks to our teachers and families for their guidance and support. Thank you for listening.